My name is Dr. Masha, and I'm going to start with a question that might hit closer to home than you expect. What if a quiet part of your body suddenly started demanding attention after 60 years of not giving you any trouble? For decades, most men never gave their foreskin a second thought, whether they still had it or not. But now, with the changes that come with age, hygiene might be trickier, irritation more frequent, and suddenly, your doctor's saying the word circumcision, and you're thinking, at my age, really? But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. This isn't about telling you what's right or wrong. It's about giving you straight, judgment-free facts so you can make the decision that fits your life. Let's start with the basics. The foreskin isn't just extra skin. Medically called the prepuce, it's a natural fold that covers the head of the penis. Its job? Protection. It shields sensitive glands from friction, keeps them moist, and is packed with thousands of nerve endings that can heighten pleasure. Some men swear by it, others don't notice a difference, but either way, it influences not just how things work, but how they feel. So, why do some men choose to remove it? Historically, circumcision has been rooted in religion and culture. In the US, it's been a routine infant procedure for decades. In much of Europe and Asia, it's far less common. Globally, about 37 to 39% of men are circumcised. But what if you've lived with your foreskin for over 60 years and now it's causing problems? A common issue is phimosis, when the foreskin becomes too tight to pull back, often due to age-related changes, irritation, or scarring. This makes hygiene harder and sometimes painful. Another is recurring inflammation, like balanitis or balanoposthitis, painful infections that bring redness, swelling, discharge, and discomfort. If they keep coming back despite good hygiene, circumcision may be the long-term fix. Then there's paraphimosis, when the foreskin gets stuck behind the head of the penis, cutting off circulation. That's an emergency, and if it happens once, doctors often recommend surgery to prevent it happening again. Of course, not all situations are urgent. Sometimes it's just hygiene. Let's be real. After 60, bending over in the shower, staying flexible, and even seeing clearly can be harder. That extra fold of skin can trap moisture and debris, what doctors call smegma. While smegma itself isn't dangerous, if it's not cleaned well, it can cause odor, itching, and infection. For some men, daily care is no problem. For others, especially those with arthritis, mobility challenges, or vision issues, cleaning becomes a chore or even a health risk. In those cases, circumcision can simplify life. Fewer places for bacteria to hide, fewer infections, less worry. Now let's talk sensation. The foreskin is loaded with fine touch nerve endings. For some men, it boosts pleasure. It also keeps the head of the penis soft and moist, adding comfort during intimacy. So does removing it dull sensation? Sometimes yes, sometimes no. Many men circumcised later in life do notice reduced sensitivity to light touch because the newly exposed head undergoes keratinization. The skin toughens slightly. But here's the flip side. For men dealing with pain, tightness, or chronic inflammation, the relief outweighs the subtle loss in sensation. And remember, sensitivity declines naturally with age. Testosterone drops, nerves lose responsiveness, blood flow slows. The foreskin is just one factor in a much bigger picture. Then there's body image. Some men feel self-conscious about having a foreskin. Others see it as something worth preserving. In the US, circumcision is common. In Europe, Vietnam, and much of Asia, it's rare. What's normal depends on where you grew up. If you're considering surgery now, ask yourself, is it for health or just to fit in? If you're in pain or facing repeated problems, surgery may make sense. But if you're fine physically and just feel cultural pressure, pause. Confidence doesn't come from matching someone else's body. It comes from owning yours. Before making any decision, you need to understand the procedure and its risks, especially after 60. Circumcision is generally safe, but recovery takes longer. Older skin heals slower. Conditions like diabetes, high blood pressure, or blood thinner use add complexity. You might have more swelling, a slightly higher chance of minor bleeding, or discomfort that lingers. Rarely, there can be cosmetic concerns, too much or too little skin removed, uneven healing, or visible scarring. That's why it's critical to choose an experienced urologist. Sensation may change, with the head becoming drier and less sensitive. For some, that's barely noticeable. For others, especially if sexual response is already reduced, it can be more significant. So, is it worth it? If you're dealing with repeated infections, chronic inflammation, or you physically can't clean well, circumcision can be a life improver. But if your foreskin isn't causing trouble, think about alternatives first. Steroid creams to soften and loosen tissue, gentle stretching techniques guided by a doctor, or partial procedures like preputioplasty that relieve tightness but preserve some foreskin. Sometimes better hygiene habits, warm water, mild soap, regular care, are enough. In the big picture, whether you have a foreskin or not is just one part of your health after 60. Circulation, hormone balance, prostate health, and emotional well-being all shape your sexual comfort and confidence. Removing the foreskin solves certain problems, but it's not a magic fix for energy, intimacy, or connection. Those might need better sleep, better blood flow, or an honest conversation with someone who understands. Here, we talk about total men's health, physical, sexual, emotional, because that's what truly makes a difference. If your foreskin is causing trouble, see your doctor, get examined, know your options, avoid myths and guesswork. If you're comfortable and clean, there's no reason to remove something that's been part of you for decades. What matters most is how you feel, not how others think you should look. Take control, be informed, make choices that respect your body, not pressure it. And if this video brought you clarity, like, share, and subscribe so we can keep making respectful, science-based content for men who want to stay strong, confident, and healthy at every age. And if you're ready for something more practical, check out the next video, 3 exercises to boost your erection and sexual function, a no-pill, age-friendly routine designed just for you. Thanks for being here. Take care of yourself.